Hello and welcome to a very special episode of the Retirement Readiness webinar series. I'm your host, Mr. David Vigil. And with me is a special guest speaker, Mr. Chris Frederick. Hey, Chris, how are you?
How are we doing?
We are doing fantastic. Chris is the owner and principal agent of Good Shepherd Insurance Agency out of Sacramento. And he has been so kind to do this a second time, because this is our second time doing it. This is the second episode. You're probably wondering, hey, you're on episode 7. Why are you doing 2? Because unfortunately, I did not hit the record button last time. So Chris was gracious enough to come back on, and that we're going to do it again. So Mr. Chris, again, we're going to be discussing Medicare and all things about it. He has a presentation, and I'm going to sit back and let Mr. Chris present and jump in with questions. All right, sir.
All right. Well, please do. I like the more conversational presentations anyways. So, hey, thanks for being on the call, and I appreciate the time to be able to present. We own an insurance agency that is looking to help people and make sure that we can not only, of course, make things a little bit more clear, because Medicare is extremely complicated, but just be a trusted resource. And we come from a position where we're an independent shop, which just means that we have the ability to shop around for you. And we don't work for the insurance company, we work for the client. So that's where our heart is. We just want to be on your guys' side and show you what's out there. And so we have a presentation today. It's a pretty cool presentation. I have a big family. I got 5 kids. And so every presentation I ever make, I think to myself, I want to be so clear that my 4-year-old could understand what's going on. Now, that's a miracle when you look at Medicare and all of the different plans and parts and all sorts of things. But this presentation, I'm telling you, it's super simple. And I think it'll at least get us really dangerous. And then the only other thing I'll say too, just kind of a disclaimer, this is the year of 2023. And since this is recorded, just understand that these values are all estimations. The 2023 values will change once 2024 hits. And so we're not going to talk about specifics on actual co-insurance and co-pays with different plans. This whole thing is just to get you guys really dangerous and knowing what to do for Medicare and kind of the next steps to make sure that you guys make an educated decision. So did I miss anything, David?
No, that's perfect. That's exactly what
okay.
The series is all about.
Okay, good. All right, cool. So the door at 64. All right. So it's all about the door. All right. Now you're like, what is going on? I thought we were talking about Medicare. What is this door at 64? Now, if you can imagine this door and you guys just walk up to this door magically can open at certain times and it can't open before certain times. And so what is going on here? So if you look here, I don't know if when I zoom in, are you guys also zooming in?
No,
I just want to make sure. Not yet.
No.
That's okay if not. I'm going to use my cursor. Okay. Okay, so how about, can you see my laser?
It has your name highlighted.
The delay might be a little funky, so I might not use that. Okay, that's it. All right, well. All right, so we are on, at least you guys can see the slide. Is that true?
Yes.
Okay, all right. All right, so the door at 64. So this is a timeline of when we can open this door at 64. Now, in Medicare, it all has to do with enrollment. If you do not enroll, nothing happens unless you're taking Social Security income, and then you'll be automatically enrolled. And so if you're taking Social Security income, you will be automatically enrolled if you've been taking it for about 4 months or longer. Anything shorter than that, they assume that you're not retired yet, and you may not be wanting to enroll. And so you'll have to enroll in the Social Security website. So when can you enroll? Well, if you look here on my drawing, the enrollment door is on your 65th birthday month, and everything is working off of this 65th birthday month. And 3 months before that birthday month, you have the ability to enroll. The effective date will not come into play until the first day of your birthday month. And so you see there your magical 65 birthday month. You've been working for so long and so hard for this ability to open up this door of Medicare. And 3 months before you can enroll, I encourage you guys to jump on it as quickly as possible. It's just going to make your life a lot easier, because once you enroll, there's just so much information there. You'll want to give yourself enough time to make a good decision. Before 3 months before your 65th birthday month, the door is locked. You can't jump into Medicare, of course. And so we also do health insurance before 65. We help people with Covered California. It's a totally different world. Medicare is something completely new. But before that, you can't get into it unless there is some sort of a disability. And if that is you, you can give us a call and we can talk about what that looks like. For the majority of people, though, we're waiting until we're 65 to jump into Medicare. After 3 months after your birthday month, you actually are penalized. There's a lifetime penalty that's assessed to your Part B premium. And it's a penalty that goes on forever. It's not a one-time penalty. It's one of their ways to kind of limit the risk of people signing up later and jumping in when they need it and not jumping in with everybody else. And so again, the thing that you need to make sure, the door at 64, I call it that. It's a clever saying because it gets you thinking when you're 64 years old, this is when you need to start preparing and decide what you're going to do with Medicare. Any questions on that, David, so far?
No, pretty straightforward.
Pretty basic.
3 months prior to your 65th birthday, your enrollment date isn't until the first day of your birthday month, correct?
Exactly. Now, effective date is the first day of your birthday month. Yeah. So there's all these terms, but yes. Enrollment, you can actually enroll before. Nothing happens until the first day. The earliest that your effective date will be the first day of your birthday month. If you enroll after that, you still have that 4-month window from your birthday month to 3 months after that you're not going to be penalized. But if you enroll, your effective date will just be the first day of the next month. It's pretty basic. All right, so we're going to jump in here. So, if you can, again, I like these pictures, but when you're opening this door, the reason you're so pumped and the reason I'm excited is because really Medicare is a birthday present. All right. So you're 65 years old, you get a birthday present. It's called the Federal Health Insurance Program, which is Medicare, and it's called Part A and Part B. Now, Part A is a free birthday present. Part B, you actually got to pay for. It's kind of an odd birthday present, but in light of health insurance premiums being so expensive, it actually makes sense. $164.90 for health insurance isn't really that big of a deal. The reason I'm so excited, though, about Part A and Part B when I'm on the phone with our clients is because of the actual value that's here. I mean, this is an extremely valuable health insurance. We have guaranteed acceptance. Everybody has the ability to jump into it, assuming they've worked 10 years or more. We have the freedom of a nationwide network. So if you have a specialist in North Carolina, we're in California, you have the ability to say, hey, I have original Medicare, and assuming they're accepting new patients, you have the ability to go over with your Medicare Part A and B and utilize that doctor's expertise. Protection. You have an immense amount of protection, and it will show you how to even extend that protection further. But for the most part, we're not going to get into the specifics of what Part A and Part B cover. Just generally speaking, A is medical or hospital insurance, B is medical insurance. But we're not going to talk about the specifics because most of what happens after Medicare is really in the next decision after you've enrolled in Medicare. Will you choose option 1, which is original Medicare plus a Medigap plan, or will you choose option number 2? The reason people are choosing these two options is because, roughly speaking, original Medicare Parts A and B cover about 80% of your medical cost. There's no out-of-pocket maximums, and so this is why most people say, hey, I want to go to basically the next step and somehow limit my risk so I don't have an out-of-pocket maximum that's endless. And just to give you an idea, I mean, if you were to have $1 million medical expense, which, of course is pretty extreme, but it could happen. And it covers only 80% of that cost. Well, now you're stuck with $200,000. That's a pretty hefty bill. And so most people say, you know what, I will choose one of the two options after we look at original Medicare and we've enrolled. It has some great features, but we want to kind of step it up to the next level. I put in there, Part A is $0. And again, what most people do is when they're 65, whether they're working or not, they go ahead and enroll. Part B is $164.90, and there is a second option. You don't have to take your Part B, and the reason you would not take it is because you have what's called credible coverage. So I don't know if you see down there in red, I said continue credible coverage. It's kind of an or. You're either going to take Part A and B, or you're going to take Part A and credible coverage. Now, what is credible coverage? Credible coverage is when you have an employer that has over 20 employees. The federal government says if they are offering health insurance, you have an option to take their health insurance instead of your Part B, and you'll delay Part B. So you'll enroll in the $0 premium. You'll delay paying the $164.90 because you have what's called credible coverage from an employer. The moment you do not have credible coverage and you retire, you issue what's called a special enrollment. And that special enrollment will allow you to jump back into Part B and potentially add one of these two choices that we'll talk about after. David, any questions so far?
No, makes complete sense to me.
Yeah, it's pretty basic. Again, this is what you've been paying for. This is why it's so inexpensive. You get a $0 hospital insurance, Part B, $164.90 medical insurance. You have a nationwide network. You have guaranteed acceptance. You have an immense amount of protection, 80%, roughly speaking. Again, that number, if you want to get into the specifics, give me a call and I will show you the layout of what these two cover. You can also Google it and totally geek out on it. But for the most part, you have to understand that there's no out-of-pocket maximums, and that's what brings us to step number 2. All right, so let's continue on. So next slide, this is, oops, hold on here. Trying to move it down here. This is a T-chart of really
Chris,
the two.
We're still looking at the door at 64. Are we still supposed to be still looking at that screen?
No, it was supposed to move on actually. So maybe you guys have the ability. Do you guys have on pages on there? On the bottom right corner, you should be able to get to different pages.
Grid, line grid, bottom right corner. There we go. I think I'm in control now. There we go. So we got Medicare birthday, presence, guaranteed acceptance, freedom, protection. Are we on slide
number 3?
All
Thank you for telling me that. Well, I don't know why it wasn't going for me. All right, so we are at the T-chart of original Medicare.
We're getting there. I'm not sure what I clicked here. Me and technology do not mix well. Page 2. There we go. Page 3. There we go. T-chart. Yay.
All right, we got the T-chart. Sorry about that, guys and gals. All right, so here is our T-chart. Okay, so we have, going back to what the last point was, is original Medicare. Again, we talked about the guaranteed acceptance, the freedom. The main point that I really want to get across today, just again, help you guys understand why is there so many plans and parts, what's going on, is after you consider protection of 80% of your medical expenses, you have to start to think, well, there's no out-of-pocket maximums. This could get pretty expensive. And so what most Americans do, and this is almost split 50-50, and Medicare Advantage has been kind of, I guess, increasing in their policies, but you really have two choices. The first choice is original Medicare plus a Medigap plan and a drug plan. So 2 separate plans added to your original Medicare. You keep your nationwide network, and a Medigap plan does what it says it's going to do. It fills in the gaps. All right. You also add on a drug plan, and we'll talk about those in a little bit. But it's pretty basic. You keep your original Medicare. You keep the federal health insurance program. You can go to a doctor in Charlotte. You can go to a doctor in Montana or Texas or wherever you want to go to, assuming they're accepting new patients. And the Medigap plan essentially attaches onto original Medicare and says, hey, we'll pay for everything but something, right? So back in the day, they used to have what's called a Plan F, and it just said, we'll pay for everything. Okay, now the best plan that you can purchase is a Plan G. I say best plan, the most comprehensive plan. And it will pay for everything but one deductible. In this last year, in 2023, the deductible was only $226. Now, that'll stay very small. It's the Part B deductible. But this plan altogether between your Part B premium, and this is not including what we call IRMAs, we'll talk about IRMAs, but your Part B premium, your Medigap plan, and your Part D drug plan, this is an estimation, but this is going to be pretty close to what you guys will pay at the age of 65 in the year of 2023, is roughly about $320 between those three plans all working together. Now, I have to tell you, being in the industry, you get to see the good and the bad, all right? When we set somebody up with this plan, this is the most seamless plan that I've seen. We get far less complaints about it because there's not anything that really changes. You have a big federal health insurance program. The doctor says, I will accept that agreement, or they don't. Now, 90% of the doctors in the country do. And so you have this huge network. Nobody argues the prices. And so the Medigap plan that attaches to the original Medicare doesn't argue anyways, because it's already agreed upon. It's what's called Medicare assignment. And they say for this procedure, it's this much cost in this area. And the Medigap plan says, well, we'll cover everything but a certain amount. And so for a Plan G, that's, again, $320 between all of these things together, you're only going to be paying out of pocket max of about $226 for that year.
And Chris, just
that
to put it in
coupled,
perspective, your analogy about the $1 million insurance amount due, you would just pay expense. You would just pay $226 out of that, right?
You just pay $226, yeah.
And then your max out for the year, as anything else happens, there's no more out-of-pocket cost.
Yes. So the easiest thing to explain, one of the easiest things to explain, it looks a little complicated because you got three things that are all working together, but I'm just telling you, I'm in the industry. I don't get any complaints from this setup. And this is not, I'm not trying to sell this over the other one. I just want you guys to understand the federal health insurance program is a nationwide health insurance program. It is what it is. And the doctors say yes or no. And most doctors have said yes. So it's a really, really seamless setup. Again, the thing I want to stress is the freedom that the plan gives you when you stick to original Medicare. You do not have a private insurance company managing your healthcare, which means if David over here, once he gets older, okay, he's still, 30 years away from something like this, but a knee replacement, okay, and David says, you know what, the best knee replacement guy I've heard, my cousin had him, he's out in Houston, I got to go to Houston. He has the ability of, assuming that doctor is accepting new patients, to use his original Medicare in California with his California Med Sup plan that he purchased, and he can go over there. The most he's going to pay that year is the Part B deductible. Now, who knows what that is in that year, but I can tell you it's been right around a couple $100 over the last few years. Pretty cool setup. Any questions on that one, David?
None whatsoever.
Okay, second setup. So again, half the Americans do this, is what we call Medicare Advantage. And this is probably where you see all of the commercials every year. And it's a great system, okay? But there are a couple holes, and I got to be honest with them, and I just want everybody to know about it. So how did Medicare Advantage plans come about? Well, there's something called Part C of Medicare. This is Medicare Advantage, all right? Now, Part C of Medicare, if you elect that, you're still paying your $164.90 in Part B, all right? But now you are accepting the ability to say, you're not accepting the ability, you're accepting a different network altogether. You're saying, I'm going to forfeit my original Medicare rights, and I'm going to accept a private insurance company to manage my healthcare. Now, I want you to know that because you no longer have your nationwide network. You now have a private health insurance company, very similar to maybe your HMO or your PPO plan today, that tells you, hey, this is how we do healthcare. Now, that can be nice, right? Some people love Kaiser because it's all in the same building, but that also can be a nightmare situation where maybe you want to go to a certain doctor and you can't go to that doctor because it's not in network. So Medicare Advantage, the way that they really manage those plans is they know how to direct their clients. Hopefully, this is out of goodwill, but sometimes it seems like it's more out of, it might be a little more efficient cost wise. And you got to be careful with that, because when you jump into these plans, the only way to jump out of a Medicare Advantage plan back to original Medicare with a Med Sup is you have to be what's called underwritten. You have to know, you have to have a health that they're going to say, hey, you know what, we're okay, you coming on our plan. But what most of the time happens is you look at that and you say, hey, that's $120 cheaper. I'm going to jump onto this Medicare Advantage plan. I hardly ever go to the doctor. And then something finally happens. You start to see how this plan is kind of managing your healthcare. And you're like, you know what, I'd rather be in the driver's seat. You call up me and you say, hey, Chris, I want to jump back over to original Medicare plus a Med Sup. And now you can't do it because your health is poor and you can't get approved for a Med Sup plan. So this is one of the things that you got to look out for. Now, all that being said, the Medicare Advantage plans are improving. So it's not all bad. One of the things that I love about Medicare Advantage plans is, well, they're a little cheaper right off the bat, okay? But they also include a whole lot of extras. Now, again, this is different plans, gym memberships, dental, vision, sometimes hearing too. There's a lot of things. So if you're looking at a plan that maybe has a focus on the person that's already healthy and that's going to stay healthy forever, right? That's kind of not really, but then you're probably going to want to stick to a Medicare Advantage plan. If you already have health issues already and you want to keep that freedom and flexibility, you'll probably stick to original Medicare. The PPO networks are something a little bit newer in the Medicare Advantage world, and it's kind of a cross between that HMO and the original Medicare network. It does offer the ability to go out of network. The only problem I've seen is that the doctor that is out of network also has to accept a new PPO plan under their system. And sometimes they're just not as willing to work with a new carrier when they already are set up and it's just one client, one patient. They're not too worried about it and say, we don't do them. So you still have to get the provider to accept your PPO plan. The other reason I think that people maybe stick away from Medicare Advantage plans is your out-of-pocket maximums. Now, the government sets the out-of-pocket maximums every year. So this last year in 2023 was $8,300. That is in network. Out of network, it's $12,450. And so these out-of-network costs and out-of-pocket maximums, I think, are pretty big. They're not usually this big. If you look at a plan today in, like, let's say Placer County, where I'm at, you'll see that most of the carriers undercut the market, and to get more people onto these plans, they'll actually have an out-of-pocket max quite a bit less than whatever the government sets. But it's good to know that those out-of-pocket maximums are considerably more than your original Medicare plus a drug plan. Any questions so far, guys?
So the Medicare Advantage plan, does that cover drugs as well, like the original Medicare, Medigap? You have to
Good question. Yeah, so most Medicare Advantage plans have a drug plan included, and not all of them, but most of them do. The option number one with original Medicare Med Sup and a drug plan is something separate. How much do those cost? Those things range from, on the low side, $5 to the high side. I've seen some plans, closer to $70 a month. And those have a totally different pay structure, and we'll get into that a little bit, but benefit structure than these two different plans. So Medicare Advantage plans have co-insurance, deductibles, co-pays, like a typical health insurance plan. Your Part D drug plans are quite a bit different than that. They have tiered drug systems and cost associated with them. All right, so any other questions?
I do not.
All right, so we're trying to blow through this because I want you guys to get an understanding of this. I think we can kind of get into the weeds, but there's a few other things that I want to show you. And do we have our slide deck that I sent you, David?
Yes.
Or do I have to pull that up?
I have it.
Okay.
If you want me to share it.
Yeah, go ahead and share it. And then if you want to go to page 26, these numbers that we're talking about are based off of a couple that's making under $194,000. And it's important to know that once your income exceeds that amount, they actually start adding on additional cost, which is called an IRMA. And so I'm going to show you guys the 2023 table for the IRMA for your Part B premium.
Chris, it
And
looks like you're going to have to share it. Unfortunately, since I'm recording, it's not allowing me to share here.
okay, all right. Host disabled participant screen sharing. Oh, now it says it disabled it.
Oh, because I was trying to share. There you go. Should be able to do it now.
All right, there we go. All righty. Okay, we got this shared, and let me pull up the presentation.
While we're waiting, Chris, if you want to touch on, I believe we're getting close to open enrollment season for Medicare, correct?
We are getting close, very close.
Do you want to explain what that means for folks?
Yes. So open enrollment. So there's quite a few different enrollment times. Can you guys see me right now when I'm sharing this too?
No. Well, we see your screen.
Okay. Well, I'm going to stop sharing. Here you go. Okay. Back on. Okay. I'm going to open this while I'm talking here. So open enrollment times, this is again another kind of nightmare part of Medicare is there is enrollment times, it seems like, for everything. There's AEP, there's OEP, there's IEP, there's GEP, there's a birthday enrollment time. I mean, there is just over and over again, just enrollment times for seems like everything. And so there's two that are really, really important, and I need you guys to remember them. The first is the AEP timeframe. That's the annual enrollment period between October 15th and December 7th. And this enrollment time has to do with two different things, okay? The first is Medicare Advantage plans, okay? So this is the time that you can switch a Medicare Advantage plan without having to go through underwriting. The second is your Part D drug plans, okay? So if you remember my two different T-charts, one was original Medicare plus a Med Sup plus a drug plan. This is when you can switch that drug plan. The other was your Medicare Advantage plan. It's all kind of all-inclusive. These two, your Part D drug plan and your Medicare Advantage plan, can be switched during that October 15th to December 7th. So what do you need to look out for? Well, there's a couple of things. There's plan changes that happen throughout the calendar year. And again, most carriers, they don't like switching anything, but things happen and you might have a doctor fall in or out of network. You might have a drug that was covered that isn't covered. You might have a new drug that's on the market that you want to go try, but maybe your drug plan doesn't cover that. This is the time where you want to switch it. Now, the biggest variations I've seen are relating to prescription drugs. I had a client that I was working on in Reno, and this client had a drug plan that he was on, and he had, unfortunately, cancer. And with his drugs, his out-of-pocket that year was $15,000 on drug cost. Now, it's quite a bit, especially when we just talked about Medicare supplement plans and medical expenses only being up to $226. Well, the drug world is totally different. The Part D drug plans can go a little bit higher. Now, when we looked at these plans, we had to decide which plan was right for him. And so during that time, we were able to bring down his drug cost for the year by $5,000. So again, Part D drug plans, the biggest thing is just understanding what drugs you're currently taking. What most people seem to do is they tend to jump on a really cheap plan when they're not actually needing a lot of drugs. And once they actually start using some of the drugs, then they'll switch during that AEP timeframe. Medicare Advantage plans, again, my objective is to really find a plan that is sustainable and it's not going to fluctuate a lot, because the worst thing in the world is to have to switch this every single year, get a new card, have to go to your doctors, have to find new doctors. You really want to pick a plan that is there for the long run. And there's a couple carriers, I won't tell them right now just in case we listen to this and now they're out of the industry. But again, you find an independent rep and they have the ability to find that stable plan for you. Other time frame, I know that I talked about 2 time frames. The other time frame for med sup plans is the birthday rule. So have you guys heard the birthday rule in California? David, I'm sure you've probably heard. Maybe a little bit,
No.
no?
Yeah, a little
Yeah,
bit.
it's kind of
I'm just playing devil's advocate. No, I haven't.
yes, yeah. Well, the birthday rule is something kind of cool in California. So you have the ability to switch your med sup plan from equal to lesser value without having to go through underwriting during your birthday month. So when does this come into play? Well, most of the time somebody picks up plan G, they kind of sit there and they just stay there because it just works so well. Everything's kind of functioning. What you have to look out for, sometimes depending on the carriers, you'll be with a carrier that'll undercut the market at first. They might price out a really good plan G and it's only, I don't know, $95 for that calendar year per month. And then the next year they jump it to 120. And then the next year they jump it to 130. And then the next year they jump it to 140. And this goes on and on. And if you're with a carrier that has historically high inflation on those plan G premiums, well, then you're going to go up with them. And nice thing in California is you actually have the ability to jump out of that plan into a different plan of equal or lesser value. And what we've been doing a lot of times is using some of these companies. I guess I'll give up a couple of my. Here's some knowledge here for you. For United Healthcare, they actually have historically the best inflation for Medicare supplement plans. Now, that's in my area. Again, every area is a little bit different, but they've been a great carrier because we've seen their plans just kind of level out and not do this skyrocketing thing. I was working on a couple months ago, 275-year-olds, and we switched them to a United Healthcare plan. And then we ended up looking at how much they saved over the calendar year is over $1,000. And again, this was a couple that was on a set, income, and they had expenses that they needed to meet. And so it was just something nice to be able to do for somebody. Pretty neat. All right, so I am going to jump in and just go ahead and give you guys the IRMA charts off of line, because that last presentation that I have, I sent it off, but I'm not showing where it is. Part D. Okay, so this is a really important bracket here that you guys will want to understand. If you are making, as an individual, over $97,000, as a couple, over $194,000. So I am going to my desktop number 2. And so just want to make sure, David, are you seeing this?
We're seeing it. We're seeing the IRMA chart.
Okay. So this is for 2023, even though it says 2021 income, and it's because an IRMA is calculated based off of the income that you made 2 years prior. So for 2023, whatever you did in 2021 will be tallied up, and the Social Security office and Medicare office will decide to give you your Part B premium based off of these values. So this can add up pretty quick, especially if we start making a good amount of money. And so just to give you an idea here, so right here, $194,000 or less, this is the $164.90 that we talked about. Once we jump over that, your premium starts to jump up. This is per person. And so, I don't know, this continues to go up, has a maximum up here of $560.50. This turns into kind of health insurance before 65, once you have kind of higher income limits. And it's just good to understand that, especially in financial planning world, this is important to David. When we look at premiums going forward, we need to have in mind that this is based off of income 2 years before. This is your Part B premium. If you go down here, you'll find the Part D premium, and this is added to your Part D drug plan. This will come from the Social Security office. These aren't as steep. So above 194, it's an extra $12 per month. And of course, capping out at $76.40 per person.
And that's regardless if you go to original Medicare or Medicare Advantage, correct?
That is correct. That is correct. Okay, so outside of that, there's really one other thing that I want to make sure that we all are on the same page with. And this is just a nice piece that Medicare put together. And for those of you in Medicare, you'll love this. If you want to be a Medicare geek like me, you can download an app that's called Medicare.gov, and it'll show you what is covered and what is not covered. It's a really cool app. In fact, I'll show it to you right here, real time. All right. It's in my business here. This is what it looks like.
I downloaded it myself.
Right. And this is really cool. You can tap in anything in here and it'll tell you if it's covered or not. It's not going to tell you the cost of it. It might tell you kind of how it's handled a little bit. But the biggest thing is helping you understand what is going to be covered, what is not covered. There are quite a few things that are not covered. Again, we talked about dentistry work, dental work, eyeglasses, vision, hearing, hearing aids, acupuncture, stuff like this that you probably have a good idea that it's not covered. But there are plans, I will tell you, kind of a teaser here. And again, I can't talk about the specifics of next year plans until October 1st. But there are plans that will start to cover some of the chiropractic work. They'll include some of the dentist. They're not only discounts, but actual insurance. So there's some really cool things. And most of this is relating towards those Medicare Advantage plans. Other than that, I think this is a good place just maybe to stop and pause and ask some questions. And I don't know if there's anything else, David, that you have on your mind that you'd want to address?
No, that's it. I wanted to just explain the Medicare parts, how they work, the options, which you did in great detail, which is perfect. I will end the recording here, but I just want to say again, if you have questions, you watch the presentation, want to look at different options for you and your spouse or just for you, please reach out to myself. I am David Vigil. I am the president of Vigil Wealth Services, and Mr. Chris Frederick. He is the Medicare specialist. Reach out to myself at david@vigilwealthservices.com, and I will get you in contact with Mr. Chris Frederick. Chris, thank you for doing this. I really appreciate it. And we will stop the recording now.
There you go.